This is Case of the Week 21. My name is Dr. Johnson and I'm a gynaecologist from Southampton. The patient was 40 years old and had heavy periods. She had no pain, her smears were up to date and she had no hot flushes or night sweats. A recent pregnancy test was negative. This is a transvaginal ultrasound of the pelvis, of the uterus in the longitudinal plane, scanning from cornu to cornu. And this is a transvaginal ultrasound of the pelvis scanning in the transverse plane from cervix up to fundus and back down again. From cervix up to fundus and back down again. What's the diagnosis? Is it a normal pelvis? An ectopic pregnancy, an interstitial pregnancy, a copper coil, or an Assure device? If we look at the videos together, this is the scan of the uterus in the longitudinal plane. So the patient's head is here, her feet are here. This is the anterior surface of the uterus, there's bladder, cervix is here, posterior wall of the uterus and the fundus. And you'll see that there's a little bright structure there. This is the endometrial cavity. Scanning out the other side, another bright structure. So in the longitudinal plane there are two little bright structures, one at each cornu, passing into the endometrial cavity. If we look in the transverse plane, this is the patient's right and this is the patient's left. The bladder again is at the front. Here you can see the endometrial cavity, and on each side there's a little bright structure passing into the interstitial portion of the fallopian tube on each side and into the endometrial cavity. There's the cavity, there's the metal structure going through the interstitial portion of the fallopian tube to beyond. If we look again at the 2D images in the transverse plane, so this is the patient's right, this is her left, you can see that here's the little metal structure passing through the interstitial portion of the fallopian tube. It just reaches the endometrial cavity, which you can't see in this view. This is with normal gain, and when I reduce the gain, you could still see these structures. This is the view of the coronal plane, so this is the uterine fundus, and this is the cervical area, and you can faintly see an endometrial cavity. But what's striking is that you can see this little structure going through the interstitial portion of the fallopian tube, one on each side. This is an Assure device. Assure coils are metal coils which are fitted one in each fallopian tube for sterilization. The ideal position includes a small portion in the endometrial cavity, then the coil passes into the interstitial portion, and then a little turn of the coil in the fallopian tube, just where it joins the uterine body. You can still see the coils when you reduce the gain because they're made of metal, just like a copper intrauterine coil. The patient had menorrhagia because she stopped the combined pill after having the Assure coil fitted for sterilization. Thank you.